patient who is in her early 30s, had her implant, comes in from the Northeast, has implants from 2016. So this is just 8-year-old set of silicone implants below the muscle. And she had the symptoms of breast implant illness. So she comes, as you will see, I removed the skin, total capsulectomy 6524 GR. I removed the excess skin over here. And as you will see, as I go in, surgery went very well. The blood loss was minimal, a lot of inflammation. We knew going in, these are just 8-year-old set of implants. These are supposed to be the better, the these are the implants that have been reintroduced into the market '07. But as you can see how weepy this is, this is just the significant inflammation. As I remove, you will see you're more on the yellow side. As I go in, you will see the inflammation around it. And this is the fluid. If I go look at it, you can see how it's very viscous. You cannot send this in just such a small amount to cytology, but this is where you have that gel bleed that's occurring. So as you will see, this is your Allergan 378, just like the patient mentioned. And you can see, look how much significant amount of fluid there is that's on the towel. I'm going to go ahead and remove my top glove. The left one was indeed very much what I use the word ruptured, as you will see. There's a mass that I removed on the left side. It is what appears to be consistent with what is a lymph node. I'm just going to call it a mass, left chest mass. I'm going to send this off separately to pathology. Now, as I was dissecting on the left side, I removed some of the tissue from around underneath the skin to help with the contouring. As I was dissecting, there was an inevitable break because of the way it was tightly adherent to the rib and part of the muscle. So what I did was I used what are these Raytex sponges, and you can see the moment as soon as you see a break in the capsule, I was able to plug this in. You can see how it sticks. And these are just 8-year-old set of implants. So I had a total of 16, as you can imagine, all around and covering it up, and I dissected, and you can see all of it was plugged. It wants to pour out. As you will see, everything was contained. None of it spilled into the chest. And so all of this was contained, and this is the part that was sitting onto the rib, if you will. And everything went very well all the way around. And so what I'm going to do now is I'm going to go in, and this is the dissection where you can see how it is truly ruptured. Everything was contained. The patient did not get drains. And as I go in, you will see very thin flap. You can see the scissor over here. Implants from just 8 years ago. So fairly recent, and you can see it is indeed very much ruptured, completely disintegrated. This is supposed to be that gummy bear safe implant. And if I go in, look at this tissue, looks like a placenta, if you will. This is very, very small calcified tissue. I'm going to go ahead and send this along with the capsule. And let's see on the inside, you will see a lot of inflammation. This is very, very inflamed. Some areas are so thin you can actually see my glove here at the bottom. And so you'd see these white patches, no fluid, and all of this tissue has been removed completely. You see these white patches. Everything inflamed has been removed completely, definitively, sincerely. And as you will see again, these white patches over here. So the goal here is no matter what, one has to always assume that the implant's ruptured till proven otherwise, because you don't want this to spill into the chest. Look at again overall over here to this how molten type this is. And it will leak and leach into everything was contained. None of this spilled into the chest. I'm going to go ahead and try to lift this up, and you can see it's completely disintegrated up at the top part. This is 378 again. None of it spilled into the chest. The patient is a young 32-year-old. She's not going to get drained. She's not going to get the unnecessary lift. None of the silicone spilled into the chest. Everything was contained. Blood loss was minimal. And all of the inflamed tissue was removed. As you see, there is no indication for a drain. I contoured the chest such that the breast would fall nicely without the need for the unnecessary lift. I've taken cultures for bacteria and fungus. I'm going to return the implants to the patient. I am going to send the capsules off to pathology, rule out the BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, rule out BIA squamous cell cancer, which is the breast implant associated squamous cell cancer. And then on a separate left chest mass, which is clinically grossly consistent with what is a lymph node, just to make sure there is no abnormal pathology. And then we will see, most importantly, how our patient is only going to bounce back to a normal state of good health minus these toxins, minus the significant severe inflammation. So, look, 8 years into her augmentation, just from 2016, she has a rupture. She's noticed, and this is a surprise for me, that she was ruptured on the left side. And this is again goes to show that the implants are not safe. They can rupture. And according to the guidelines by the manufacturers, you will see that they recommend getting a MRI at year 3, and then every 2 years they're onward looking for what is a rupture. The surgeon has to go in knowing that the implants are ruptured. I always assume that the implants are ruptured till proven otherwise, so that none of the silicone spills into the chest. If the silicone spills into the chest, then that's a major catastrophe. No matter how long you have the drains, uh, the, the silicone toxicity will persist. It will spill into the chest and continue to cause all the harm that it does, given the silicone granulomas, amongst the other problems that arise as a result of the silicone spilling out. There you have it. This is Dr. Khan, Executive Plastic Surgery.